Imagine bleeding, not for days, not for weeks, but for 12 unbroken years. Welcome to the medicine behind the miracle, where we do not explain away the miraculous, but rather we examine the depth of the disease so we can better understand the magnitude of the healing. Today we look at the story of the woman with the issue of blood, her possible diagnosis, what bleeding for that long could do to the human body, and of course, the miracle. This is not merely a story of faith, this is a story of chronic illness, medical exhaustion, social isolation, and finally, instant and complete healing. In modern medical terms, this condition would be classified as chronic abnormal uterine bleeding. This refers to persistent, excessive, or irregular bleeding from the uterus. 12 years of ongoing bleeding is not minor, it is clinically severe. And this condition is actually a symptom indicating underlying pathology. While scripture does not specify the diagnosis, there are several conditions that could account for excessive and prolonged bleeding. So first on the list we have uterine fibroids, which are also known as leiomyomas. These are benign smooth muscle tumors of the uterus and they can cause heavy, prolonged bleeding. Next we have endometrial hyperplasia, which is the abnormal proliferation of the uterine lining. And this causes the blood vessels of the uterine lining to be fragile and unstable, which would result in persistent bleeding. The next possible diagnosis is endometriosis. Endometriosis is a chronic gynecological condition where tissue similar to that of the lining of the uterus grows outside of the uterus. Simply put, the endometrium grows where it doesn't belong, and just like typical endometrium, it responds to hormones, so which means it grows, it bleeds, and it can swell. And this condition can cause heavy and prolonged menstrual bleeding. So these are just a few of the possible conditions that she could be dealing with. Let's look at the physiological consequence of such chronic blood loss. Firstly, when the body loses blood over a long period of time, it doesn't just give up immediately. Instead, it goes into survival mode, activating multiple compensatory mechanisms. So one of the first compensatory mechanisms is increase in heart rate and cardiac output. But this would lead to palpitations, dizziness, and extreme fatigue. And over time, this could put her at risk to cardiac failure due to prolonged strain on the heart. Blood vessels would also constrict to try and maintain blood pressure and to reduce further blood loss, which would lead to cold hands and feet, paleness, and dizziness. The bone marrow would also go into overdrive, trying to increase the production of red blood cells, but this requires iron, vitamin B12, and folate, and with chronic bleeding, iron stores deplete over time. Over time, compensation fails, and chronic iron deficiency anemia develops. This results in severe weakness, headaches, brain fog, fainting, and reduced immunity. Chronic blood loss also triggers the release of stress hormones like cortisol and catecholamines, and this leads to weight changes, mood changes, and even sleep changes. She would also experience infertility because chronic uterine pathology often prevents conception. The point is, the body can compensate for years until it can't. Her body had learned to survive on less blood, less oxygen, and less strength, but survival is not the same as healing. This woman was not simply ill, she was slowly wasting away. Such a chronic illness does not only affect the body. 12 years of bleeding would almost certainly bring depression and anxiety. Mark records something striking. She had suffered many things from many physicians. So she obviously did not ignore the problem. She was actively looking for solution. Ancient treatments likely included herbal remedies, ritual cleansings, and other invasive and harmful procedures, but none addressed the hormonal irregulation, the coagulation disorder, nor the structural pathology. In fact, Luke, being a physician himself, noted that she grew worse. Anyone she touched became unclean. Anywhere she sat became unclean. This meant no temple worship and no public gathering. So not only was she dealing with this crazy condition, but she was also isolated. That's a lot to bear. Hearing that Jesus was passing by, she made a decision. Knowing that touching Jesus would make him ceremonially unclean, she chose secrecy over spectacle. And she said to herself, if only I could touch the hem of his garment, I would be made well. And she did touch it, and scripture says, immediately her bleeding stopped. This implies abrupt hemostasis, immediate stabilization of uterine vasculature, and instant correction of underlying pathology. There is no known biological mechanism, ancient or modern, that explains such an event. 12 years of pathology ended in a moment. This miracle was not only about stopping bleeding, it was about restoring her dignity, ending isolation, and giving her back her life. Medicine could not heal her, society rejected her, but faith connected her to a power beyond human limitation. When science reaches its limit, scripture invites us to look higher. This has been the medicine behind the miracle. When medicine explains the disease, but the miracle speaks for itself. If you enjoyed this episode and would like to see more videos like this, please like, subscribe, and hit that notification bell. Thanks for watching.